Consider this. In 2008, the American Medical Association renewed their disavowal of physician participation in the death penalty. They emphasized that physicians, as guardians of health and life, have a duty to uphold human dignity, even in the face of legal mandates. It's a topic that makes us pause and wonder, should healthcare professionals be involved in this? According to the World Medical Association and other medical bodies, the answer is a resounding no. They argue that physicians should uphold the sanctity of life and refrain from participating in acts that go against their core values. So, join us as we navigate the complexities of justice and grapple with the ethical dilemmas that come with it. Because when it comes down to it, this story isn't just about the law, it's about the choices we make and the kind of society we want to be. But why nitrogen? In the evolving landscape of capital punishment, significant changes are afoot. Once the predominant method, lethal injection is encountering increasingly complex challenges, such as shortages of essential drugs and procedural complications. As a result, several states are actively exploring alternative avenues to fulfill the solemn task of carrying out executions. One such alternative gaining traction is the utilization of nitrogen gas. This method has garnered approval in a handful of states, including Alabama, Oklahoma, and Mississippi. In stark contrast to the intricate concoctions of drugs involved in lethal injections, nitrogen gas presents itself as a seemingly simpler, yet no less controversial, option. However, the adoption of nitrogen gas as an execution method raises a plethora of pressing questions. How can its administration be conducted in a manner that upholds safety and human dignity? Furthermore, concerns abound regarding transparency, particularly underscored by the opaque nature of Alabama's plans, which leave crucial details undisclosed, thereby fueling speculation and skepticism. The turn towards nitrogen gas reflects a response to the myriad challenges associated with lethal injection, yet its efficacy and ethical implications remain subjects of fervent debate. As society grapples with these weighty considerations, it becomes increasingly apparent that the terrain of capital punishment is undergoing profound metamorphosis, necessitating rigorous introspection and dialogue regarding the fundamental principles of justice and morality that underpin our legal system. How does it work? Let's delve deeper into the intricacies of nitrogen gas executions. In Alabama's plan for Smith, the execution protocol involved the utilization of a mask to administer nitrogen gas. Likely, Smith would have been securely fastened to ensure safety during the process. As nitrogen displaces oxygen in the body upon inhalation, it induces death by depriving the brain and tissues of the vital oxygen needed for sustenance, effectively leading to respiratory failure. Some proponents suggest that unconsciousness would likely ensue swiftly, potentially offering a more humane alternative compared to traditional execution methods. However, a critical uncertainty remains. The timing and certainty of unconsciousness during nitrogen gas inhalation remain nebulous, as medical experts cannot definitively ascertain when, or if, unconsciousness will occur. Smith's execution commenced at 7:53 p.m., with his official declaration of death at 8:25 p.m. Nitrogen gas flowed for approximately 15 minutes, with official accounts indicating that the procedure unfolded as anticipated. However, contrasting reports from media witnesses depicted a divergent narrative. They observed Smith appearing awake for a brief period, followed by trembling and movement on the gurney. Eventually, his breathing decelerated until it ceased altogether. Officials attributed Smith's movements to attempts to hold his breath, citing phenomena such as agonal breathing, which typically occurs during the dying process and is characterized by gasping for air. This discrepancy between official narratives and eyewitness accounts underscores the unpredictability and potential variability inherent in nitrogen gas executions. Despite the procedural framework, the disparity between anticipated outcomes and observed realities prompts a crucial question. Is this method truly the optimal approach to administering capital punishment? Addressing concerns about pain, Widespread apprehension arises regarding the potential for nitrogen gas executions to inflict suffering, raising ethical and legal quandaries. United Nations experts caution that such executions could constitute torture, expressing apprehension over the prospect of a potentially agonizing and undignified demise. Medical professionals acknowledge the uncertainty surrounding Smith's experience, highlighting worrisome possibilities. Inadequate sealing of the mask may permit oxygen leakage, prolonging the process. Additionally, the risk of seizures stemming from oxygen deprivation presents a distressing prospect. Further concerns revolve around the possibility of the individual regurgitating into the mask, leading to choking or inhalation of stomach contents, which could cause severe lung damage. Notably, alterations to Smith's last meal schedule due to repeated vomiting underscore the tangible risks inherent in this method. In essence, while nitrogen gas executions represent an attempt to address the shortcomings of conventional methods, the complexities and uncertainties surrounding their implementation provoke profound ethical and practical dilemmas, prompting a critical reevaluation of the morality and efficacy of capital punishment practices. Bottom line, the absence of sedatives heightens the psychological turmoil for Smith, amplifying the dread preceding his execution. The looming specter of impending death, compounded by the absence of calming medication, exacerbates his anxiety to unfathomable levels. Without the customary numbing agents administered in lethal injections, Smith is left to grapple with the full weight of his impending demise in a state of stark consciousness. Furthermore, the lack of pre-anesthetic compounds not only intensifies Smith's apprehension, but also raises concerns about the procedure's efficacy and potential complications. In the absence of sedatives, the risk of procedural mishaps looms large, threatening outcomes ranging from severe injury to irreversible brain damage. Smith's vulnerability to such outcomes underscores the inherent cruelty and inhumanity of the process. Moreover, the absence of sedatives sets a troubling precedent, paving the way for future executions devoid of basic humane considerations. By subjecting individuals to the full brunt of their fear and anguish without the mitigating buffer of sedation, society risks descending into a realm of callousness and brutality, where the sanctity of life is callously disregarded in the pursuit of retribution.